Now I want to give you some background on our benefit advisors. You may be surprised, but the average age of the benefit advisor at Extend Health is actually 43. That means when you call in to Extend Health, your benefit advisor who you speak to could very well be on Medicare themselves already. And so in addition to having worked with Medicare and being a professional in the industry, they probably have some personal experience working with these plans. Now, for your convenience, we do want to make sure there's plenty of time for the Acera retirees to be able to call in and hear about this different information and hear about these plans. And so from Monday to Friday, 5 a.m. to 6 p.m. Pacific time zone, you can call in with any questions you may have. And so that's a 13-hour window of time in which you can call in, and we would love to be able to assist you at that time. One of the things you're going to love about the benefit advisors is that we have a 100% domestic workforce. They're actually going to be based either in Utah or in Texas. That means the benefit advisor you speak to will be fluent in English. They'll also be objective. They're going to make sure that they're finding out those individual needs that you have, and they're basing the recommendation they give you upon what you tell them. They are once again neutrally compensated. They're paid salary. And so for them, it's not they're going to get paid anything differently based upon the plan you enroll in. They do have a very rigorous training process they go through every year to keep on top of these Medicare plans. Just like many things in our lives, they do tend to change year to year. And Medicare is exactly the same way. Your benefit advisor who you speak to, of course, has to be licensed in your state. So, of course, many of you retirees will be in the state of California. Your benefit advisor who you speak to will be licensed in that state. They also have to be certified and appointed with the many different insurance companies who are options in your area through Extend Health. And so let's say there's 40 different plans. There could be quite a few different companies offering that coverage. Your benefit advisor will license with those companies and appointed and be able to share that information with you. So let's talk about the enrollment process. Your benefit advisors will be waiting to receive a call from you on your appointment date and time. The process for enrollment is handled all over the phone. And your benefit advisors, if needed, can speak with a trusted friend or family member if you need that assistance. And so some of you may not understand all the information. You may have that family member who you want to be on the phone line with you. That's perfectly fine. Simply tell your benefit advisor, hey, I have this friend or family member. I want them to be on the phone line with us to hear this information and help me understand it. Give your benefit advisor that person's phone number. They can actually three-way call them and add them on the phone line with you. That way they can be there to hear that information with you. Now once you've made your plan decision and you're comfortable with the plan, you will over the phone have to verbally state at one point that you intend to enroll in that plan, for example, in 2013. Now for your protection and to ensure those benefit advisors are giving you top-notch customer service, we do record 100% of our phone calls. One of the things your benefit advisor will ask you about is your red, white, and blue Medicare cards. There's actually some key pieces of information on this card that they need to get because it goes on the application for the plan that you choose. And so they will ask you how your full name shows on that card. They're going to ask about your Medicare claim number on that card. Now that may look like your Social Security number with a letter before or after it. They will also want to know your Medicare Part A and Part B effective dates. So let's go ahead and talk about now your future coverage and what that will entail. First of all, you also have your primary coverage, your Medicare Part A and Part B. What you'll have as additional coverage for that will then be the plan that you choose. It could be a Medicare Advantage plan with prescription drug benefits or a Medigap plan with a standalone Part D prescription drug plan alongside of it. So let's discuss those two big options for your coverage and what you can choose from. First of all, option one, your Medigap plan with a standalone Part D drug plan. A Medigap plan fills in the gaps in original Medicare. That's your Part A and Part B. That means it will help pay the difference between the total costs and the amount that original Medicare will pay. These plans provide additional coverage for your doctor visits and hospital stays, as well as other expenses that are partially covered by Original Medicare. Medigap plans do not include prescription drug coverage, and so that's why you can choose a Medicare Part D drug plan to go alongside of it for those drug needs. Let's talk about the other option, option 2, your Medicare Advantage plans. The Medicare Advantage plans are network-based plans that provide an all-in-one plan that bundles your Medicare Part A, your Medicare Part B, and your prescription drug coverage together into one plan. These plans provide coverage for your doctor visits, hospital stays, and prescription drug expenses. So let's talk about Medicare prescription drug coverage and how that works. Under Medicare drug coverage, there's 3 different levels. The first one's called your initial coverage level. Under this, you pay your deductible and copays for your plan for the first $2,970 in actual cost of your medications. Once you reach that amount, you hit the second level of coverage called the coverage gap or donut hole. At that point, you pay 47.5% of the cost of brand name drugs and 79% of the cost of generics until out-of-pocket costs reach $4,750. And once you reach that out-of-pocket cost, you hit the third level of coverage called catastrophic coverage. At this point, you pay $2.65 for generics and $6.60 for brand name drugs, or 5%, whichever is greater. So I'm sure you're all curious. You want to know some examples or hear some information on plans based upon your local area. And so I did look at some plans based upon the Oakland area and specifically in the Alameda County for 2013. And so let me go ahead and go over and give you an idea of options at this time. So for your Medicare Advantage plans, those are your network-based plans. We have 3 different plans being offered. Those range in monthly premium from $32 a month to $79 a month, and those are from the companies AARP and Humana. For your Medigap or Medicare supplement plans, there's 24 different plans being offered. Those range in monthly premium from $64 a month to $268 a month, and those are from the companies AARP, Aetna, Humana, Anthem Blue Cross of California, Sterling, and Blue Shield of California. For your Medicare Part D drug plans, there's 23 different options in this area, and they range in monthly premium from $19 to $118 a month. And there's a large list of different companies those are being offered through as well. So let me give you some plan examples of what you could expect to see. First of all, your Medicare Advantage plans. In this example, I chose to use a HMO. It has a monthly premium of $62 a month, no deductible. If you go in to see your primary care physician, it's a $0 copay. And if you go in to see your specialist, it's a $5 copay. For your hospital care, days 1 through 8 are a $100 copay per day. And if you go to the emergency room, it's a $65 copay. If you're admitted, it then becomes one of those hospital days. This plan does include the drug coverage with it already. Your Tier 1 preferred generic drugs at your local pharmacy are a $0 copay. Your Tier 2 non-preferred generics are a $10 copay. And then your Tier 3 preferred brand names are a $45 copay. And then the price goes up from there if you have non-preferred brand names or even specialty drugs. This plan does offer the 90-day mail order service. And so with a lot of plans, it's possible to save money with that route. So for those of you who are interested in that, this plan does include that feature. Let's talk about another example, a Medigap plan with a standalone drug plan. For this example, I choose to use what's called the Medigap Plan F. It happens to be one of the more comprehensive supplement plans. In this example, we also used a 75-year-old male to give you an idea of what you can expect for costs. For this plan, there's no network. You can see any doctor that accepts Medicare. Your monthly premium would be $186 a month for the Plan F Medigap coverage. And in this example, I even chose to give you an idea of what you could expect to pay for a standalone drug plan that goes alongside of it. For the drug plan that I chose, it's a $48 monthly premium. For this Medigap plan, there's no deductible, no primary care physician copay, no specialist copay, no hospital copay, and no emergency room copay. Under the drug plan that I'm giving you as an example, there's no deductible. And for your prescription drugs, your Tier 1 preferred generics will be a $3 copay. Your Tier 2 non-preferred generics will be a $5 copay. And then with your brand names, they start as low as $40 and they go up from there. This drug plan as well does include the 90-day mail order feature.